Okay, I want you to imagine a pain so intense that the weight of a bed sheet on your toe feels completely unbearable. That's not an exaggeration. It's the reality for millions of people who suffer from gout. Now, it is a form of arthritis, but its cause is something, well, far stranger and a whole lot sharper. We're talking about microscopic crystals literally forming inside of your joints. Today, we're going to pull back the curtain and unmask this crystal king. And to really get it, you just have to hear how someone who's actually been through it describes it. This isn't just a simple ache. It's described as feeling like sand, grinding in between the joint. It's so sensitive that even the lightest touch, like from your bed linens, becomes pure agony. That right there, that's the reality of a gout attack. So, how do we get to the bottom of all this? Well, we're going to tackle it in 5 parts. First, we'll talk about this unique kind of pain. Then, we'll meet the crystal villain that's causing all the trouble. We'll look at how it builds up in your body, learn about the 2 different types of attacks it can launch, and finally, and this is the important part, we'll open up the playbook on how to fight back. All right, let's start with the pain itself, because to really understand gout, you first have to understand why it feels so incredibly different from other kinds of joint pain. You see, at its core, gout is really a chemical problem. It all starts with a substance in your blood called uric acid. Now, normally it's totally harmless, but when the levels get too high, that acid does something pretty incredible and terrible. It actually turns into these microscopic, needle-like crystals right inside the fluid of your joints, and that is the source of all that agony. So, if these crystals are the weapon, who's behind them? Well, it's time to unmask the villain of our story, uric acid. So where does this stuff even come from? You know, the surprising thing is that uric acid isn't some kind of foreign invader. Your own body makes it every single day. It's a normal waste product from the breakdown of these compounds called purines. And purines are in a lot of our food, but they're also essential building blocks of our own DNA. So making uric acid, that's a totally natural process. The problem isn't that purines exist. It's when you get an excess of them. And certain foods, well, they just pack a much bigger purine punch than others. We're talking about things like organ meats, think liver and kidneys, red meats, some types of seafood like anchovies, sardines, and tuna, and of course, the famous one, alcohol, especially beer. These can really overload your system and create a surplus of uric acid.
So diet is definitely one piece of the puzzle, but what's the actual mechanism here? What causes uric acid to build up to those dangerous levels in the blood? Let's dig into why those levels actually rise.
There are really 2 sides to this problem. On one hand, your body might just be producing way too much uric acid, just an overproduction issue. But honestly, far more often, the real problem is with removal. Think of your kidneys like a high-tech filtration plant. They're supposed to pull that uric acid out of your blood and get rid of it. But if they can't keep up, the levels in your blood just start to climb. So what can trigger these issues with production or removal? Well, it's often a mix of things. Diet, like we just talked about, plays a big role, especially stuff like high fructose corn syrup and alcohol. Certain medications, like diuretics for blood pressure, can actually make it harder for the kidneys to do their job. Of course, any pre-existing kidney problems are a direct risk. And finally, lifestyle factors like dehydration, being overweight, or even just the physical stress from a surgery can be enough to tip those scales. And when those uric acid levels get too high and those crystals start to form, that's when the villain attacks. So let's look at what that assault actually feels like, both in its sudden acute form and its more damaging chronic form. An acute gout attack is just known for its dramatic entrance. I mean, someone can go to bed feeling perfectly fine and then wake up in the middle of the night feeling like their big toe is literally on fire. The pain, the swelling, the redness, it's not gradual, it's explosive. The attack gets worse and worse, peaking in intensity within about 24 hours, before it finally starts a slow, painful retreat over the next 1 to 2 weeks. And this really highlights the difference between a single battle and a long-term war. An acute attack, as terrible as it is a temporary event. It usually doesn't leave any lasting damage. But chronic gout, that's what happens when these attacks keep happening over and over again. The constant inflammation and those crystal deposits start to cause permanent damage to the joint and even the bone itself. And this right here is the visible signature of chronic gout, something called tophi. These are literally large, hardened masses of urate crystals that have all clumped together over time. They can form these chalky-looking lumps right under the skin. You often see them on ears, fingers, or elbows. But they can also grow deep inside the joints, acting like little rocks, just grinding away at the bone and cartilage. Yeah, the damage from chronic gout can go way beyond just the joints. All that constant inflammation can cause the skin over the joint to get itchy and even start to peel. And just like those crystals can form in your joints, they can also form inside your kidneys, creating incredibly painful uric acid kidney stones. The problem really becomes systemic at that point. So that's the villain's side of the story. But here's the good news. This condition is highly manageable. So let's move to our final section and open up the hero's playbook for fighting back against gout. All right, we've identified the enemy, those uric acid crystals, and we know exactly how they form. So what's the strategy for defeating them? Well, the strategy has two very distinct goals, and it is vital to keep them separate. The first one is all about the immediate problem, putting out the fire. That means relieving the pain and inflammation of an attack that's happening right now. The second goal is all about long-term prevention. That means lowering your body's overall uric acid levels to stop future attacks from ever even started. For that immediate firefighting relief, the main weapons are going to be strong anti-inflammatories. This includes common NSAIDs like ibuprofen, more powerful corticosteroids like prednisone, and there's also a gout-specific drug called Colchicine, which is super effective at reducing the swelling and pain during one of these flare-ups. Now, for long-term prevention, the cornerstone medication is often a drug called Allopurinol, and it's so important to understand this. This drug does not relieve an acute attack. It's not a painkiller. Think of it as a maintenance drug. You take it every day to block the production of uric acid, which keeps your levels low so those crystals just can't form in the first place. Of course, medication isn't the whole story here, not by a long shot. Lifestyle changes are absolutely critical. Staying well hydrated helps your kidneys flush out that uric acid. Managing your weight reduces the body's overall uric acid production. And avoiding those trigger foods, well, that's a must. And hey, take special note of this last point. This is a big one. Never take aspirin for gout pain. I know that sounds weird because it's an anti-inflammatory, but low-dose aspirin can actually raise your uric acid levels, making the whole problem worse. So when you look at it this way, gout gives us this fascinating window into our body's complex chemistry. It's really a powerful reminder that a problem in one specific joint can actually be a signal of a much bigger systemic imbalance in how our body processes things. And that kind of leaves us with a question to think about. What other common health problems out there might be hiding a similar hidden story of an internal imbalance?